Why will this panicking government not concede that Omicron is a mild variant that we should be living with rather than panicking about?
I honestly have never seen such poverty of leadership and this paucity of decision making. The fact is, the Prime Minister is trying to please, appease everyone. And of course, he wants to be friendly with everyone. And the problem is, by doing that and not making those difficult decisions, he pleases and appeases no one. And then you have to say, well, hang on a minute, there is an official opposition holding the government to account. But quite frankly, I've seen more effective wet wipes than the official opposition. It is unacceptable. They are playing with people's lives. And I'm really concerned for people in hospitality and travel, families trying to make plans. And the one thing the British public, I think, are very resilient. They can do almost anything. But the thing they cannot cope with is uncertainty. And that is one thing the government is very good at bringing, yet more uncertainty.
Now, as we were just saying, look at the statistics to do with Omicron. It's been here for 3.5 weeks now. Very, very few deaths, very, very few hospitalizations, many, many cases. Lots and lots of people are getting this, make no mistake. So it quite clearly is a mild variant that doesn't do much harm to 99.999% of every person who catches it. Why is this government, why is Boris, Sajid Javid and Sage, why are they so obsessed with suppressing the optimistic narrative about this new variant?
I think you have to be very skeptical of what Sage is up to. If you look at the latest numbers from Sage, they're saying that they predict that there'll be something like 3,000 hospital admissions a day, 1,000 deaths. And as you say, we've had 104 in hospital and 12 deaths. Now, I interviewed doctors in South Africa last week as part of a television program I was presenting, and they think we're absolutely crazy. If you look at the data from South Africa, admissions have fallen by 25%. If you look at Denmark, their hospital admissions have fallen by 60%. So clearly, what that would lead you to believe, and remember, they're weeks ahead of us, what that would lead you to believe is that actually, as we would expect, the virus is mutating, it's becoming more transmissible, but it's actually becoming less dangerous. And we'd expect that to happen. And that is the way that viruses tend to change and evolve. Now, the problem is that Sage, and this came out yesterday in a frank email exchange, I think with Fraser Nelson at The Spectator. And it seems that the government has asked Sage to look at the worst case scenario. But as you rightly say, there is a worst case, there's a middle case, and there's a best case. And I would have said, actually, you need to err on the side. Yes, be cautious. But 92.8% of adults over 18 have antibodies to this. We know there aren't the hospital admissions. And actually, you said something in a trail I listened to earlier, which is that actually the role of the NHS is actually to protect us and not the other way round. If it cannot cope after 2 years of this, the most incredible vaccine rollout, there is something fundamentally wrong at the heart of the NHS. 52% of the payroll goes to non-clinical staff. So that shows to me the NHS is not fit for purpose and needs massive reform.
Every year, David, we are required, and this goes back to way before COVID, but especially during our COVID era, we are required as a people, as a population of Britain, to change our lives. So particularly with COVID, to dramatically change our lives in order to facilitate the needs of our health service. That is fundamentally wrong. If we have a health service that cannot cope, it isn't the people that have to change, it is the health service. We've become a country attached to a health service which is held in kind of almost religious, mysterious high esteem. This year, I know we say this all the time, but this must be the last winter where the people of Britain, the long-suffering people of Britain, are expected to change their lifestyles just because of the needs of a substandard health service that cannot cope.
Well, you've got to remember that the health service was set up in 1948 as a sort of amalgamation of existing services. And of course, it was never set up to do what it now does, where it's trying to offer all things to all men. And if you remember, the BMA opposed the creation of the NHS back in 1948, and they were cajoled into doing so by paying them an absolute fortune. And there are parallels with what's going on now. The fact is, GPs are being paid a lot of money to make sure more people are vaccinated. Meanwhile, 750,000 people are not getting cancer checks. we're seeing the waiting list skyrocket. So the question is, either this is fit for purpose or it isn't. And I think increasingly the evidence shows it's not fit for purpose. We will never catch up. There are people who are seriously ill. Talking to a surgeon today, he said he's got 2 patients who he is very worried about, who have cancer, who need operations. Now, if he operated today, he would be able to make sure that they lived a good quality of life and would probably be cured of those cancers. If they wait 6 months, those cancers will spread and those people will not survive. That is unacceptable. That is a second-class service. That is something you see in the developing world and not in the United Kingdom.
The NHS is not overwhelmed, not by a long chalk right now. I think I read somewhere that something like 5% of COVID patients, of the beds are taken up by COVID patients at the moment. However, it does seem to be steering towards trouble, and the reason is this. Just as a lot of companies are having the same problem, that many frontline NHS staff, doctors and nurses, are once again being pinged, or more to the point, are testing positive and therefore having to go into 10 days of self-isolation. The responsible thing to do right now, if you have to go into an office like I do, is to test every day. Doctors and nurses are doing that, all power to their elbows. However, they're getting loads and loads of positive results. Therefore, they have to go home for 10 days. Therefore, the NHS has got a staffing crisis. Therefore, it is edging towards being overwhelmed because of this new pingdemic, if you like. Now, this is only anecdotal, but I have 4 friends from various walks of life who are currently in self-isolation, having tested positive, doing what I do every day, doing a lateral flow test, coming up positive, 10 days off. Not a single one of them. I've been talking to them on the phone. I said, well, how are you? Absolutely fine. Absolutely fine. Nothing wrong with me. Now, my point is this crisis that we're finding ourselves in, particularly concerning the NHS, I mean, is it self-created? We've got loads and loads of people at home self-isolating who aren't sick. So testing positive is the cause of our current crisis, not sickness. That's mad, isn't it?
Well, I think it is mad. I belong to a group of doctors and we have a WhatsApp group where we're talking about the need for testing. And I think the overwhelming feeling is stop testing. Stop testing unless you're unwell, because if you test and you find positive cases, what do you do about it? Now, that is also compounded by a number of other variables. We've lost so many beds in the NHS. When I started, when I qualified, we had 300,000. We now have 165,000. There's no capacity. And at the same time, the population has grown by 10 million. So you do the maths. There is no capacity. That's the first problem. Secondly, we run it hot. We don't retain our staff. So we're bringing in agency staff, and many wards are completely understaffed anyway. And then you've got staff who have had 3 jabs, who are testing positive but can't go to work. Now that we also know that having those the booster, having the vaccinations doesn't stop you getting COVID, and it doesn't stop you transmitting it. So you have to then ask yourself the question, what is the point of testing? What are we actually trying to achieve? Because we will never eradicate it. And when I read of yet more lockdowns, make no mistake, I think that is coming on the 28th when it looks like Parliament will be recalled, then I think you then have to say, well, what are we trying to do? If you lock down, all you do again is you flatten the curve. You don't change the area under the curve. So this is a virus that we have to learn to live with. It will always change and mutate. And the fact is we need to get on with this. And the problem is what SAGE and what the government are doing are looking at the health economics. They are not factoring in what it's doing to people's mental health, to businesses. Rishi Sunak's now announced even more money for hospitality and for travel. What about all the other small businesses that are really struggling? So this is a very complicated equation or circle they've got to square. And I think the problem here is that they are making it more and more difficult for themselves because they are continually testing. I think we have to say enough is enough. Let's look at the admissions, but ultimately stop testing, get people back to work and get on with a normal life.
And until we do that, I mean, to go back to my earlier point, at the risk of repeating myself, we have a kind of phantom crisis. The crisis is being caused because so many people are having to self-isolate, having done the responsible thing, testing, but they're not ill. Yeah. So we have a sort of pandemic of people who are not ill. This is absolute insanity.
Well, let's look at parallels. So do we test everyone for the common cold? Do we test people for flu? No, we don't. If you feel ill, you go to bed. And we know that when you're symptomatic, that you're more infectious. So that to me would make far more sense. For those people who have been pinged, maybe do 2 lateral flow tests. If they're negative, you should go to work. And I think the government knows that they've got a major problem with the 10 days and they need to reduce it to probably 7, if not less than that. But ultimately, we don't go around testing for every other virus. And you can quite happily work with a cold in a hospital and with flu in a hospital. And the fact is that one other thing, and we haven't talked about this over previous weeks, but remember, vaccination is not the entire key to this. We have so many new drugs coming online. We've got antivirals, we've got nucleotide prodrugs, we've got remdesivir, molnupiravir. We've got all these drugs that are waiting in the wings. And I think we have to realize that this is going to be a mixture of making sure people get the boosters and then also having those drugs up our sleeve. If you look at the booster, actually, the new data shows Moderna gives you something like 35 times more antibodies, and the Pfizer gives you something like 25 times those antibodies. So it's fairly clear, actually, that once you've been boosted, the effect of those boosters will be significant in terms of reducing hospitalization and, crucially, reducing death. But again, it doesn't stop you getting it, and it doesn't stop you transmitting it.
So I've just been handed the sort of most recent figures for England, hospitalizations and deaths for Omicron. And that is up to the 19th of December. So what is that, a couple of days ago? 133 confirmed hospitalizations, 14 deaths after 3.5 weeks. That's not exactly sensational, is it? No. I don't know the facts of this, and the government keeps saying we haven't got all the details. But you're a doctor, David. I mean, even for a layman, after 3.5 weeks, everything we've heard from South Africa, this low number of hospitalizations, extremely low number of deaths, it's reasonable to conclude Omicron is a mild variant that doesn't make people very sick. Is that a fair conclusion? I
think that is a fair conclusion in this country. And of course, you see, when you've got people like the World Health Organization talking about COVID globally, that's a very different game. When you talk to doctors in South Africa, they're 2 to 3 weeks ahead of us, and the data looks good. What I don't understand is politically, and I understand that the government is in serious trouble because you've also got not only the rebellion over vaccine passports, the fact that Lord Froster's resigned, and the Shropshire by-election where the government got an absolute hammering, or the Conservative Party got an absolute hammering. So politically, they are very worried about what they're going to do. So they have to make a decision. Do you say, right, we lock down now and we make sure the NHS is protected? Or do we actually hedge our bets, look at the data from South Africa and think, well, actually, on balance, I think we're probably going to be okay. I also think people are grown-ups. I think people can be responsible, give them the proper facts and let people make the decision for themselves and stop playing with people. No one knows what to do over New Year. What is the hospitality industry going to do? How much food do they buy in? How do you get staffing? And what are families going to do? I think the effect to society generally is far more dangerous than the effect from this variant.